It was quite a ride this week for the American Optometric Association. More than 500 doctors and students opened Washington's eyes to what optometrists do for healthcare in America, and in the process made AOA history.
Healthcare reform in the United States is going to happen, and it's going to happen rapidly. The reality is that as an individual optometrist, we can make a huge impact on that change in healthcare. When you are the optocrat, the person that really shares the message with that legislator, the real message of how you can impact lives, they'll make a change and they'll do the things that we ask them to do because it's right for their constituents, which are our patients, and that's going to be good for our profession.
It was, in fact, the largest gathering of optometrists ever assembled to lobby legislators here. An impressive display of AOA members' presence, passion, and persistence in bringing their message directly to the U.S. Capitol.
Access is definitely, probably the number one.
I would like a verbal from these offices that says they will support the federal legislation that we are asking them to co-sponsor.
Okay, thank you.
In one-on-one meetings, AOA members helped lawmakers understand that they are on the front lines of patient care and are a vital part of the communities in which they live and work, an important piece of an ongoing AOA strategy that has worked to foster understanding and develop deep relationships with members of Congress and advance optometry's priority issues on Capitol Hill.
I'd like to thank you for all you've done, allowing and making your staff available to us.
Good.
Especially 1884.
Well, we're hopeful we'll see that passed. We got good bipartisan sponsorship.
The AOA Congressional Advocacy Conference and every one of the hundreds of doctors who participate in it are making an important difference by bringing optometrists' message directly to the United States Capitol and making sure we are all better informed.
The AOA is committed to keeping its membership actively engaged in advocacy efforts. They believe that optometrists can and should play a vital role in healthcare reform efforts.
Our advocacy efforts are at their best when the AOA Washington office is taking the profession's message to Capitol Hill, but then AOA key persons are reinforcing that message through their direct contacts with members of Congress on a regular basis. Certainly this conference is a key opportunity to provide those contacts, but it needs to be done on an ongoing basis and a continuous basis.
Okay. AOA's member advocates came armed with compelling stories from home. Dorothy Hitchmuth is an optometrist at a VA hospital in New Hampshire. She's fighting this week for those soldiers who have served our country and now need care.
We see a lot of patients with diabetes, a lot of patients with hypertension, a lot of patients with both, a lot of patients with other neurovascular disease who suffered stroke. We see a lot of patients with glaucoma. If my patients didn't have access to optometry, they wouldn't have any eye care.
Thank you. I feel like I should be applauding you. And
veterans are some of AOA's staunchest allies. In fact, Tammy Duckworth, who President Obama tapped to be an assistant secretary at the Department of Veterans Affairs, says she owes her vision to her optometrist back home in Illinois. Duckworth, an Army helicopter pilot, lost both legs and severely damaged her arm when she was shot down in Iraq. She credits the protective eyewear provided to her by her optometrist with saving her sight.
The shrapnel made its way into my face, and those glasses saved my eyes because they were completely covered and impregnated with jagged shrapnel, and the only shrapnel that made it through in the vicinity of my eyes was just on the bridge of my nose, which it pulled out, but nothing made it through those glasses.
AOA honored Duckworth for her support. Also honored Rear Admiral Michael H. Mittelman, the highest-ranking military optometrist ever and the director of the Navy's Medical Service Corps. He oversees care for soldiers in Afghanistan and other war zones.
Never before in my career has military medicine had such a significant role in what we do in the world. The two top winners for these missions are optometry and dentistry.
Also recognized, an AOA member who was also a member of Congress.
It's great that you're here. Your staff up here is doing a tremendous job. Thank you for all that you do. I can't tell you how proud I am to be a member of this profession.
These doctors and students who are committed to the profession and to AOA believe eliminating unfair attitudes about optometry will be good for patients and good for the profession.
You have earned your right to practice. Whatever they put in front of you, go right through it with conviction and confidence.
Without question, the conference was a huge success with record-breaking participation and impact across Capitol Hill. And even as doctors and students celebrated, AOA maintained focus on the challenge of national healthcare reform and the need to continue to expand optometry's federal advocacy efforts.
We have to ensure that our patients have access to us, have access to eye care through optometry, and we want to assure our doctors that they're able to provide services to those patients and to do so in a non-discriminatory way.
Doctors and students can step into spring during next year's AOA Congressional Advocacy Conference and make sure that optometry continues to be listened to and heeded in Washington, D.C. The meeting is set for March 2nd through 5th. For more information, visit www.aoa.org or contact the AOA Washington office at 1-800-365-2219. Reporting from Washington, this is Nancy Mathis.